All right, welcome back. We want to talk this morning about your lung capacity. Lung Disease Awareness Month just wrapped up, and of course, your health and taking care of it is an ongoing thing. So, this is something that does decrease with age, your lung capacity. And when we say capacity, how much air your lungs can hold. So, this morning, we're talking to Dr. Kathy Nguyen with Optum Southlake. She's joining us to talk more about our respiratory health. Good morning, doctor. When we think about lung capacity, I was reading up that we can hold, if we're healthy, we can hold up to three, what's equivalent of like three large soda bottles worth of air in our lungs. Why does that decrease as we age?
So before I dig into that answer, just the basic understanding for your viewers, main function of lungs is to move the air breathed through our lungs and take it to our vital organs. Our lungs take the oxygen that's needed out of that air, and the other main function is to release the waste product, which is mainly carbon dioxide.
Mm-hmm.
Um, and and black cells kinds of day to help move that air. Now, why the lung function can decrease as we get older. So normally our lungs are mature by the time we're 20 to 25 years old. But once you reach 35 years of age, it's normal to see a slight decrease in lung function as you get older. The important thing is slight. So if you see a sudden or rapid change, that may not be normal. You definitely want to let your doctor know. Reasons why function declines first, the muscles that support your lungs, such as the diaphragm, that's a large muscle that sits beneath your lungs, helps to expand and relax your lungs. Those can get weaker with, so that will make it more difficult to breathe. Also, the tissues that in your lungs support weight, it tends to lose as you get older. It makes the airways smaller. So it makes it harder for air to move in and out when those airways are smaller. Finally, you have the rib cage, your chest wall. That's where your lungs sit. Those bones can get thinner and smaller as you get older, and that leaves less room for your lungs to expand. So that can lead to breathing loss as well.
Mm-hmm. What are some of the practices we can do to stay healthy and really make sure we're maximizing our health when it comes to our lung capacity?
When it comes to lung capacity, I know we haven't talked about lung disease, but one common
Oh,
thing
okay.
that can cause lung disease is smoking. So if you're smoking, it's easier said than done, but please try it. You can talk to your doctor about ways and strategies to help quit smoking.
Mm-hmm.
It's also important to avoid any secondhand smoke exposure.
Mm-hmm.
So, talking about the things that we breathe in, the quality of the air that we breathe in, either your outdoor environment and indoor
Mm-hmm.
environment, can also affect our lung capacity and our ability to breathe. So,
Mm-hmm.
there's a lot of pollutants out there. So,
Mm-hmm.
also something to keep in mind. Um, Second thing would be staying active. Exercise, we know, is very important, strengthening your lungs, strengthening which the heart and lungs work hand in hand with each other. With exercise, your lungs use your oxygen more efficiently
Mm-hmm.
and also can help in your so and your doctor what's the appropriate exercise regimen for you because that could be different from one person to the next. Um, One last thing that can help with maintaining lung capacity is vaccinations. Patients with lung disease, especially as people get old, we know that the elderly system gets weaker with time. So you're more prone, sensitive to get colds and flus. And we have lots of vaccinations that are available to prevent different infections like influenza, 19. So make sure you consult your doctor to make sure that you're up to date with the recommended vaccinations.
Mm-hmm. And like you were saying with respiratory illness, and sometimes are all these things, some things are irreversible, but some things are not. Can you kind of explain how that works? Like some things can be
So,
improved, but some cannot, and some things can be fatal over. I mean, eventually, chronic illnesses with when it comes to your lungs.
okay. So there's a lot of common lung diseases affect different parts of our lungs. Lung is actually a complex system of many different parts. And yes, some lung disease can be reversible. For example, we can get infection that affects the airways or the lung tissue, um, like pneumonia. That's what infection lungs is called, or bronchitis, which is an infection of the airways. And those tend to be reversed and often treated with antibiotics. Lung diseases are irreversible. I mentioned smoking, common cause of lung disease. So people that smoke cigarettes, it causes irreversible damage to the lung tissue. So we have millions of clusters of air sacs in our lungs, and that comprises the majority of the lung tissue. And that's where that important function we discussed with breathing oxygen and exhaling carbon dioxide takes place. Cigarettes destroy tissue, and that doesn't reverse. So over time, that can tend to be irreversible, and people with lung disease like emphysema, that's common in smokers, they're not able to completely exhale air because of the damage it causes air to be trapped in those lungs. And that can eventually, if not treated, yes, can be fatal.
And if we want more information on this, where can we go for more information, just to bring more awareness around lung disease and making sure we're watching out for our lung health?
So, a couple of good websites that I find user friendly and also contain reliable information is the CDC, the Center for Disease Control Prevention, actually has a platform on any disease condition that would like to know more about. We discussed vaccinations briefly. The CDC also has updated schedules with what's recommended for um, certain ages and
Okay.
um, WebMD.com is also user friendly, and then American Lung Association is another source.
All right. Wonderful. Well, this is great information. We appreciate your time, Dr. Wynn. Thanks for joining us.